first guest is Dr. Tamara Patsey, who is a radiologist with a specialty in breast and breast imaging. Welcome.
Yes, thank you.
All right, now October, I think, is Breast Cancer Awareness Month.
It is.
So a lot of people are going to be talking about mammograms. So help us, when should you get one? Because there's been a lot of debate about that recently.
Well, yeah, recently there has been debate because of the Preventative Task Force Services confusing the issue a couple of years ago. The American College of Surgery, the American College of Radiology, the Society of Breast Imaging, and the American Conference of OBGYN all recommend yearly screening mammography at age 40 and every year thereafter for people at average risk. Women at higher risk start even earlier than that.
So it depends on your family history a lot.
Right.
Okay. Are you ever too old to have a mammogram?
Only when you and your physician decide together that other illnesses are more important and that it's not necessary for your lifespan to continue to worry about screening.
Okay. We talked about screening. There's the regular mammogram, there's some other things. Tell me all about the way that you can do breast imaging.
Well, we do, at our facility, we do all tomosynthesis, which is very small millimeter slices through the breasts in both directions, medially, laterally, and from superior to inferior. We do breast ultrasound if women have a palpable area of concern or a focal area of pain. And we do breast MRI, both diagnostically when women have been diagnosed with breast cancer, or in screening situations when women are considered high risk or intermediate risk for breast cancer because of multiple genetic mutations or family history.
Well, tell us a little bit about, and you use the term tomosynthesis. Is that the same as a 3D mammogram?
It is. It's 3D mammogram because of the small slices.
Now, the mammogram is radiation.
Right.
Is that anything to worry about?
No, it's still well within the FDA requirements, even with the 3D images.
And you also mentioned MRI. I mean, who would be a candidate? Because not everybody needs a screen. Well, I don't guess needs a screening MRI.
No, everybody does not, but women at high risk, meaning greater than 20% risk, given family history, given genetic mutations, women that have been diagnosed previously with atypical ductal hyperplasia or with lobular carcinoma in situ. Some women are considered high risk because of previous radiation to the chest between age 10 and 30 years, for instance, for lymphoma. Many reasons.
Now, you also mentioned their genetic mutations. That's not a radiological screening, but it is a screening method.
Right, and we have genetic counseling at Baptist to help with that. There are multiple different genetic mutations that are associated with an increased risk of breast cancer. And even things that you wouldn't think. For instance, women that have been diagnosed with breast cancer that have another family member that's a close relative with ovarian cancer, or two or more family members diagnosed with pancreatic cancer or prostate cancer. Women that are diagnosed less than age 45 or with two malignancies at any age at the same time, or where the second breast cancer later, are really good candidates for genetic counseling.
Okay, now, assuming you do get an abnormal mammogram, you also do biopsy procedures.
Yes.
Tell me about that.
Well, we do as many of them as we're able to do in a day while the patient is there from her diagnostic mammogram. Because we've got the patient there, it's faster. We get the results in just a few days, and that way that prevents the patient from having to come back for another appointment. And we have 5 ultrasound rooms, and we just do it while they're there. And
takes away some of the anxiety and the wait.
That's right.
It's great information. Thank you for coming in and providing us that information.
You're welcome.
Now here's